Hello and welcome to Health on the Line from the NHS Confederation, the organisation that represents members from across the health and care sector in England, Wales and Northern Ireland. Before we get into the detail of today's discussion, I just wanted to tell you about our EDI Professionals Conference on the 30th of April. Here at the Confed, we believe that support for equality, diversity and inclusion is key to improving the NHS in a whole range of areas. And we know that many EDI professionals are now operating under difficult conditions in a very challenging political context. So at our conference on the 30th of April, we'll be joined by NHS England's Dr. Navina Evans, the Race and Health Observatory's Professor Habib Naqvi, and the Department of Health and Social Care's Barry Missenden. So if you're interested in that, visit the event section of our website. Just put NHS Confed into your browser and it will take you there. So on to today's conversation, which I think is going to be fascinating. We've just had the latest findings from the British Social Attitude Survey, and it shows, deeply worryingly, that the British public are very unhappy with the NHS. Just 1 in 5 people, 21%, said in 2024 that they were satisfied with the way the NHS runs. Nearly 6 in 10 people, 59%, said they were very or quite dissatisfied with the NHS. And that's a sharp rise from the year before when the figure was 52%. Overall, this is the highest level of dissatisfaction with the health service since the survey began more than 40 years ago. So for many of us, this may come as no surprise, but it's very worrying, it's very disappointing. The question, of course, is what can be done about it? How can we improve the public's view of the NHS? What's driving this dissatisfaction? Now, I've got 2 fantastic people here to discuss this with me. One is Rachel Power. Rachel's CEO of the Patients Association, and Leonora Mary, who's Director of Communications for the Nuffield Trust. And Leonora is really the expert in this area. She's been involved with BSA for the past 7 years and has led the analytical team working on this survey for the past 3 years. The Nuffield Trust, with the King's Fund, sponsors questions within the survey to measure and track public views about health and care. So Rachel, Leonora, welcome to Health on the Line. And Leonora, I'm going to start with you. We are clearly a long way away from those days standing in the street applauding the NHS during the pandemic. Tell us what you think is driving these worrying survey findings and what in particular stood out from what you've seen in the survey.
Thanks, Matthew. So, as you say, in some ways not surprising, the fieldwork for this survey took place in September and October last year. In fact, just a few days after Lord Darcy's report into the NHS, and you'll remember the narrative around the NHS being broken. So it's hardly surprising in some ways to see that the British public reflect that, or perhaps the government reflecting public attitudes themselves. I think what is really remarkable is how far this has fallen. Just before the pandemic in 2019, satisfaction overall was at 60%. There was a high point at the end of the last Labour government in 2010 of 70%. That feels like a long, long way away from now. It seems extremely difficult to know how to get back from that. What's driving it? We ask a lot of different questions within the survey. There's absolutely loads that we could get into. The thing that consistently comes across is concern about accessing the NHS, waiting for GP appointments, A&E appointments and hospital care. And the A&E stuff is particularly interesting. We might come on to that. But, there does seem to be a really clear story here, which is that getting into the service itself is very, as we know, very difficult. People are not happy with that. And that is a really fundamental part of the results we saw this week.
So before I turn to Rachel, Leonora, there's so many different aspects to this to talk about, but just in terms of understanding these findings, do you distinguish between people who have actually used the health service in the period of the survey and those people who might be getting their information kind of second-hand or third-hand?
It's a really good question. So this year we didn't ask that question, but we have done in previous years. Essentially this year we moved some questions around to make room for some new ones. The question about have you had contact with the NHS in the last 12 months we've asked up until last year, and the results don't really change that much. So we can quite confidently say that it ranges massively. So remember, this is also a question we asked about social care. So people who've had contact with social care is about sort of 14%, ranging from about just over 80% for people who've had contact with GP services. So it's really important to understand that this is not a patient experience survey. It doesn't tell us specific things about people's personal experience, but from that kind of range from 14% in social care to 86% of people having contact with GP, you can see that there will be people drawing on their own experience, or those of their loved ones as well in their responses.
Yeah, and I want to come back to that in a second, but let's bring you in, Rachel. I mean, to what extent do these survey findings reflect the postbag of the Patients Association, as it were? Does this chime with what you hear day to day? And what particularly struck you about the findings?
Brilliant. Thanks, Matthew. I think it perfectly mirrors what patients tell us every day on our free phone helpline and through the various ways that we engage with patients. Patients are constantly describing to us their struggles to access care in a system that they feel doesn't listen to them as well as it did. And that's whether it's finding an NHS dentist, getting a timely GP appointment, or navigating those hospital waiting lists. People are feeling increasingly powerless in a system that they once trusted. And access and that patient agency is definitely an issue that we need. I think what particularly struck me is seeing that this dissatisfaction was spread across all services, a growing sense among patients that we hear from that the system as a whole isn't working for them anymore.
So we sometimes comfort ourselves when we see these statistics by saying that there's a contrast between how people answer questions about access and general satisfaction with what they say about the actual care that they receive. Leonora, is there still a kind of big difference there?
There is. So we see that about just over half, 51% of respondents say they're very or quite satisfied with the quality of NHS care, and 24% say they're very or quite dissatisfied. It's not great. I mean, 24% is still a significant amount of people, but there is definitely something going on there. You can sort of surmise that once people do get into the system, it's not as sort of bleak as the findings overall would suggest. We also see, and we've seen this over several years, concern about levels of staffing. So this year we asked people if they thought there were enough staff in the NHS, and actually we had 72% of people strongly disagreeing that there are enough staff in the NHS. So I think there are perceptions that aren't enough people, which is quite interesting because we know that there have been quite significant increases in some areas of staffing. So I think there's something about I can't see the right people. Rachel mentioned dentistry. That's a really clear example of some of the issues that we're seeing, where people just think, well, there aren't, I can't get an NHS dentist. Of course, there's not enough staff in the NHS.
And Rachel, the danger is for those of us in the NHS that we read a survey like this and we kind of want to check. As someone said, the problem with politics is we've got the wrong public. We want to change the public rather than change the government. And I'm not wanting to suggest that these findings aren't powerful. But if you take one area like GP access, when you look at the actual statistics in terms of how long it is taking people to access GP, the proportion of people who do get an appointment on the same day, it doesn't look quite as bleak as this. Do you think that to an extent the public respond to what they read in the media rather than their direct experience? Or do you think that the statistics that NHSE proudly tell us about access don't really reflect the reality on the ground?
It's probably both, but I think the real answer is that patients don't feel they're involved, and that issue around kind of shared decision making about where they're going to receive their service, how they're going to receive their service. Because we do hear from patients that when they get to their healthcare professional, the relationship is good. And I think, in a way, there are quick wins that we could focus on here around improving that basic communication and that administration process so that patients are getting better information about appointments, clearer letters, and more responsive ways to contact the system.
Well, that's really interesting, Leonora. So that's a kind of distinction between the product and the kind of marketing and communication of the product. And I've kind of heard that talked about elsewhere. Do you think that quite a lot of this dissatisfaction is to do with failings that we've been reading about in other reports recently, to do with kind of administration and communication?
I think that's almost certainly part of it. We did find that half of respondents in the survey agreed that the NHS does do a good job in communicating with patients about things like appointments and test results. But We know from other work, the King's Fund National Voices work recently, that people are experiencing a whole range of kind of fairly basic communication problems with the way they're interacting with the NHS. I would say, your question about the kind of the GP stats and how that compares. I think that the pandemic is a part of this. So our survey, you can see a real turning point with the pandemic. And let's not forget that some services, NHS dentistry being the obvious one, did literally close their doors to patients. And it has really struggled to recover from that. I think there's obviously most, and your members will know this very well, most health services were still running through the pandemic and doing their very best to continue to provide the care that people needed. But I think there has been a real perception that the NHS has failed to be available to people in the way that it was pre-pandemic, which I think, you look in the stats here and you can see that pandemic was a bit of a turning point.
So, Leonora, let's look at a couple of aspects of your sample. So first, I was really interested in the kind of age differences here. Older people are broadly more satisfied than younger people. We also know, don't we, that a lot of younger people are actually choosing, for example, when it comes to access to GP services, are actually choosing to go outside the health service. Give us a sense of what you think is happening in terms of the kind of age differentiation here.
We just look at sort of working age, so under 65 and under and over 65s in the BSA. There's always been a gap until last year, actually, interesting, where it converged. This year we see it coming out again. So we see that I think just 19% of the under 65s are satisfied compared to 27% of the over 65s. That's almost certainly to do with having less contact with the NHS in some ways. But as you say, perhaps something there in terms of changing generational attitudes. We're going to come on to principles, I think, what people think about the NHS founding principles. And actually, there's some quite interesting stuff there on the age differences, which isn't what you might think. So the age side of things is a really interesting one to explore. And there's more we could do. So we could break it down by even smaller groups of the respondents to look at that.
And do you find that, Rachel? Do you find differences in age groups? Do different age groups contact you with different kinds of issues?
Well, yes and no. I found that really interesting, that age difference, and it was quite striking, wasn't it? Because in terms of sometimes what we might have heard, we would expect kind of a report to show lower satisfaction. But kind of reflecting on it, I think it's about the different relationships that older people may have built up with the NHS over time. And they've seen the NHS go through quite a lot of changes and they've seen it evolve over decades. And I think younger generations are expecting to have the same experience that they have in every other part of their lives. And, where digital access and responsiveness is completely the norm. But I think it makes it difficult for the NHS because I think both perspectives are really valid. And what we need to do, as we need to do across the demographics, is to ensure that the NHS can effectively serve everyone across all age groups.
It was quite interesting because there's also, we ask people what they think the priorities for reform should be. What do you think the NHS should do? And obviously waiting times, as we know, is a huge issue and that generally does come top. But there's also a really interesting difference here, which is that the 18 to 64-year-olds are much more likely to select improving mental health services as a priority for reform. 34% of them chose it as compared to 21% of the over 65. So even in the kind of, it's not just about satisfaction, it's about what do they think are priorities for reform next. There are some age differences. So it's really interesting, worth keeping an eye on.
Yeah, because, it's not a simple distinction, but nevertheless, one that does have some basis between those people who access care episodically, that will tend to be younger people who will only reach out to the health service when they have a particular illness or they want to check something out, and those people who will tend to be older, who will have a much more intensive relationship with the health and care system, particularly if they're in that large proportion of people with long-term multiple conditions. To what extent do you think that's kind of part of what's driving this, Leonora, is that young people are responding to that? As Rachel kind of implied, they're responding to the kind of clunkiness of the kind of episodic experience, whereas older people are expressing slightly higher satisfaction when, as it were, you have more of a relationship with the health service.
I think there's definitely part of that. And the older group are also more concerned about waiting times. So we see 60% of them want to improve waiting times as one of their priorities, whereas 45% of the under 65s do. So I think people will experience a health service in different ways, and the more you're kind of encountering it at a particular period of life, that is going to colour your views. But we also have to remember that this is, because it's not an experience survey, it's quite messy, right? So those respondents will also be affected by what they're seeing loved ones go through, what they're experiencing for their parents or for their children. So it's not as clear cut. I think if you were looking at an experience survey, then you could draw more of that kind of conclusion from it than the BSA, which is a public opinion survey.
Yeah, no, it's obviously a really good point, that young people often reflect the experience of their loved ones. Now, in politics, it's sometimes said that the place where you can have the most influence is where there is a kind of contradiction in public opinion. And so there's a conflict in how the public thinks. And that's a place where politics can really make a difference in its kind of narrative and helping people to understand. Now, of course, here we have now this ever bigger kind of paradox, which is that just as we see these pretty bleak figures on access and not brilliant figures on experience, people still cleave incredibly strongly to the NHS's founding principles, although that is also fraying a bit at the edges. So, Rachel, you first. What's your experience as you represent patients of this kind of contrast between people's love for the kind of idea of the NHS and their disillusionment with the actual experience of it?
Yeah, absolutely. And we hear that all the time through focus groups and through survey work that we do, that there is that kind of unwavering support for the NHS founding principles. And while patients are deeply frustrated with trying to access care, they still passionately believe in what the NHS stands for. Because like we said earlier in the podcast, when patients finally get through that door, many are sharing very positive experiences about the care they receive from those dedicated healthcare professionals. So I think it's a little bit like we hear both the frustration and the faith. People haven't given up on the NHS whatsoever. They're asking for it to work in the way that it should, with patients at the centre. And I think they want a system that lives up to that founding promise.
Yeah, so Leonora, what's your view of this paradox between your survey, these elements of your survey?
So it's quite interesting, Matthew. I remember we introduced these questions where we ask people about the three founding principles: NHS should be free of charge, available to everyone, and primarily funded through taxes. And I kind of thought, well, we saw the very strong result that we see, and that's remained for I think we've done it for 3 years now. I remember being a little bit cynical, thinking, well, of course, if you ask someone, do you want something that's going to take care of you when you're at your most vulnerable and it's free and it's available for everyone, of course you're going to say yes. But actually, I've become a bit less cynical about these questions, because I think they're really useful to give us a sort of sense of, particularly when there are discussions and debates about, let's move away from an NHS to a social insurance model, which we saw at the weekend, or the discussions we're having about how we fund public services. I think it's really useful to get a reminder that the British public are not clamouring for a change in the model. They're not clamouring for a change in the way we fund it. They are just very despondent about the services they see. So I think these principles questions now, I've put my cynicism to the side. I think they're quite interesting and quite useful. But as you say, we do see a significant drop in the proportion of people who definitely think the NHS should be available to everyone. So when you put probably and definitely together, we still have a high level of support for that, about 77%. But those who definitely think it has now dropped, and that's particularly lower among people who are supporters of the Reform Party.
Well, I was going to come to that, because one of the other things that you have done in the survey for the first time, I think, is you have focused in on Reform voters. How do their opinions significantly differ from the general public?
Yeah, so we pulled them out, essentially. We've tended to always analyse Labour, Lib Dem and Conservative, and then other. And we essentially pulled out Reform out of other. They are no longer other. And we find that in some areas there's real divergence. So I think I mentioned they're much more likely to be dissatisfied with the NHS. We also see, perhaps unsurprisingly, that Reform supporters are much more likely to think that the NHS doesn't spend its money efficiently, so much less likely to think that the NHS spends its money efficiently. But actually on waiting times, they're, like the rest of the sample, pretty concerned about them. And then in these principles, they're the ones that we see some divergence on. What is really interesting is that we ask whether the government spends too little money on the NHS or too much. And actually, although reform voters are more likely to say that we spend far too much money on the NHS than others, still a majority of reform voters say that we spend about the right amount of money. So I think there's some really interesting findings in there. It's not as simple as you might think.
So let's turn from reform with a capital R to reform with a lowercase r. And I'll start with you, Rachel. One of the challenges if you're a policymaker is that it isn't always the case that what you think and what the evidence suggests needs to be done is the same as what the public needs to be done. One of the examples that always used to be given of this was that, you ask the public the best way to tackle crime, and they nearly always say get more police officers on the beat. But actually, that's probably not the most effective way to reduce crime, whatever its other kind of benefits. So if you're Wes Streeting and you're talking about your 3 shifts, you talk a lot to patients. What is the reform message that the public is willing to hear? What is it that they do believe? What is it that our politicians should be emphasising if they want the public to give them a bit of time to turn things round?
So from what we hear from patients right now, Matthew, is that those 3 shifts that the government are talking about have great potential. But I think what patients say time and time again is the success will depend on bringing people with them on that journey. So it's great that we're devising a long-term plan with the public, but the implementation of the plan with all the transitions that are going to have to go on between with staffing and the department and NHSE, there needs to be really clear communication and engagement with patients, because it goes beyond kind of simply redirecting traffic. We need to empower patients with the knowledge of increasing awareness of other services and professionals. So I think it's around that kind of, the health secretary talks a lot about power to the patient, and that shouldn't be just around the developing plans. Like I say, well, we need to engage patients as active participants, and especially those, because I think the concern I have at the moment is those from marginalised communities whose voices are regularly not heard in the system. And while we're looking at those shifts, we need to make sure that we hear those voices and that we don't end up marginalising more people.
Yeah, absolutely. And also particularly with the kind of broader political context we're operating in. But Leonora, let me ask you that question. I know that the 10-year plan consultation came up with some quite interesting perspectives on how the public view reform and some of the things that they care about. And, it does seem, doesn't it, when we listen to our politicians, that they think it continues to be good for them to attack managers, to attack waste, relatively soft targets. Is that still right? Is that what the public is most willing to believe in? Or can ideas like, shifting servers into community, investing more in prevention, can those chime with the public as well?
I think they can. I mean, in this survey, they don't come out terribly high on the list of priorities. So improving the health of the most disadvantaged, we have about 14% of people picking that as one of their priorities, about a third for sort of prevention and public health. But I think in other surveys, they have done, it sort of depends, as with lots of polling and survey work, it depends how you ask the question. I think the thing in terms of reform that this survey really makes clear, and in some ways it's quite an obvious point, but it really kind of makes it very obvious, is that the government has a real dilemma, because the very loud responses we hear about waiting times have to be dealt with. It's going to be really essential for the government to turn this around in order to get back and get a second term. These sorts of results we can't be seeing in the year before an election. It's although this survey in some ways isn't surprising because they've called the NHS broken. It provides this baseline for us to say, okay, has the government made any progress? So tackling some of these issues now, actually dentistry being another one that is a really visible problem for the public, is so important in order to get back in and do the longer and the harder job of the reform around the 3 shifts, because that's not something you can do as quickly as we need to see a change on these sorts of measures. So they have a real fine line to tread, and they know that. But I think it's a really big it's going to be the real challenge for the Labour government, is how to respond to that kind of waiting times challenge while also doing the longer term reform.
No, well, that's absolutely right. And that's one of the things that we find ourselves saying a lot, which is, I use this cliche split screen thinking, but somehow we have to meet that kind of immediate retail offer around access and waiting lists, but we have to do it in a way which speaks to the second screen, which is the fact that fundamentally the model of care we've got is not sustainable, and we've got to change that model of care. And we have to try to be able to work in both those kind of domains at once. I'm going to ask you both one last question. It's a tough question, but I'm fascinated to hear your responses. Obviously, we represent leaders across the service. Leaders listening to this conversation, reading the survey, thinking about what they can do to engage with their patients, their public, because it's not just about kind of PR this. If people don't feel confidence in their health service, it genuinely affects their well-being. It makes people more reticent about coming forward because they're worried about aches and pains they might have. So it really does matter to people. So starting with you, Rachel, if you're an NHS leader, you're reading this, you're listening to this, what's the one or two things that you think leaders on the ground can do to connect with the public and restore a bit of their hope and confidence?
So I think the communication, is still an issue. So I think that's something leaders on the ground can definitely do. But I think it's about treating patients as true powers in the design of services. And I think there's good evidence out there that shows that if patients are equal partners working with healthcare professionals and leaders, that satisfaction improves even when resources are as constrained as they are properly. So I think it's the right thing to do, but it's actually quite a practical way to move forward during what are very challenging times for frontline leaders.
Yeah, I agree with that. And I think it's important to recognise that NHS staff and the families of NHS staff are a very large and significant group of people in a public survey. This is unusual. Mostly when you do surveys about things, the actual people who can provide the thing you're surveying is a tiny group. But in this, the views of NHS staff and their families and friends are a significant factor. So people who work for an organisation recognising how important it is and the way in which they treat and deal with patients, even when things are tough, that they can treat them with courtesy and kindness and empathy. These things really do make a difference. So, Leonora, to you, I'm a health service leader, and I'm saying to you, well, look, I can't change this stuff at a national level, certainly not in the short term, but what can I do now to try to address people's concerns? What advice would you be giving?
So I'd probably reassure you from the work we've done on the BSA is that the public are fairly clear. If the finger of blame is being pointed at anyone, it's at the kind of national government and the overall funding that is given to the health service. The public are pretty sympathetic towards staff. The results on quality of care indicate that actually they're, on the whole, satisfied with that. So it's not all as bleak as it sounds when you hear the kind of the headline. I mean, I think it's really difficult for local leaders at the moment. It's really difficult, particularly in the context of, changes and reorganisation and job cuts. One area that often is sort of overlooked because it's not the kind of the flashing blue light ambulance and A&E issue, but it's received such a huge amount of neglect in policy terms is dentistry, but it's one that really matters to the public, and it's quite totemic, I think, in terms of it's an issue that appears in MPs' post bags. Whenever we do any analysis on dentistry, we get a lot more interest from kind of a much wider range of media, because it's one of these kind of topics that people want to talk about, and people have their own stories, and it's become a bit emblematic of what's going wrong with the state, that people can't even get into an NHS dentist. So I think that kind of thinking about how there's different parts of the system working together, and the commissioning of dentistry is going to be a really important one for the future.
That's a really important point. And I was looking at statistics the other day, remarkable about the proportion of children who go to A&E and who have a kind of oral health dentistry problem. Well, look, Leonora, Rachel, this has been a fascinating, somewhat sobering conversation. Will you both come back this time last year and hopefully reflect on a slightly more positive survey?
Absolutely, hope so.
Happy to come back next year.
Thank you both. And that just leaves me to introduce our latest Leader in 6 interview, which this time is from sunny Cornwall, where I spoke to Steve Williamson, who is the Chief Executive of the Royal Cornwall Foundation Trust. First question, what's the biggest challenge you're facing right now?
Yeah, I think the combination of the demand pressures facing the NHS right across the country and delivering those to safety within the financial environment that we have, it is a really very, very significant challenge.
Yeah, we've been talking about that this morning. What innovation most excites you in the Trust at the moment?
I think the things that stand out for me, I guess, are the opportunities to utilise digital technology to assist in the transformations already underway, to manage that demand and build on some of the fantastic performance we've seen. I think you've seen a little bit of some of our elective transformations this morning in our enhanced perioperative care facilities and our planned care units. They've been instrumental in enabling us to be forecasting one of the best elective performances in the country. So it's amazing to see those kind of things progressing.
Yeah, it was fantastic seeing the EPOC team. If you were king of the NHS for one day, what's the one thing that you would do?
I think our national colleagues are trying to do this, that the more we can empower local decision making in the interests of local communities and local patients, I think the better. And there's been a really positive direction towards that. You've seen some of the innovation that teams are taking forward. The more we can empower them, I think, to accelerate and deliver that, the more opportunity we have to move forward. There are some kind of structural aspects that have to be considered at a national level. When the scale of the transformation that the NHS is facing is at such a level, then there are some things that centrally can probably only be done there in terms of creating the environment to enable those changes to go forward at the fastest possible pace, whether that's structural support for system reconfiguration, workforce change, those sorts of things, or whether it's a planning environment to enable the changes that best support local care being able to move forward at the maximum pace.
So tell us something about yourself, Steve, that's nothing to do with your job. Something interesting.
I'm a hockey player.
Oh.
I play for Truro Hockey Club. Not a very good hockey player, but that's part of my switching off from work.
I thought hockey's quite a violent game, isn't it? Aren't you worried about, is your chair maybe worried about you ringing in and saying you got terrible injury?
I've not had the experience of a terrible injury. I have been tested on minor injury units services after a hockey ball, and they were fantastic. I didn't know who I was. Their care was amazing. Great ability to look online and see where the shortest waiting times are in our network of minor injury units across Cornwall and the Isles. So you go there, get timely care, not put any pressure on emergency departments, and really good.
Brilliant. Can you share with us a leader that you admire, maybe in the health service, maybe more broadly? You're not allowed to say Jim Mackey.
We've got some amazing clinicians in our organisation that are driving forward change and transformation. And you'll have met maybe a couple of them as you're out and about across in our organisation. So when I look at the likes of Toby, our Associate Medical Director for Urgent and Emergency Care, passionate about driving forward change in the best interests of patients, is amazing to see. Difficult to draw out one individual, but I'm struck every single day as Chief Executive that the passion, the innovation, the determination from colleagues in our organisation to drive forward change. I'm equally struck, Matthew, by the innovation and determination in other parts of our health and care system.
Yeah. And finally, Steve, share with us a bit of content. Might be a box set, might be a podcast, might be a book, something that you've enjoyed recently that you think other people would enjoy too.
Yeah, I've been reading a book, Fit in the Clouds, which is an outdoor book setting a context of challenge and how obstacles and challenges can be overcome, which is clearly nothing to do with it.
Feet in the Clouds.
Yeah, Feet in the Clouds.
So it's about mountaineering?
Yeah. So I found that really interesting, exciting, and gives a different context. But when we think about the challenges and the opportunities facing the NHS, an interesting book.
I can't think of anything more relevant to NHS bosses than to talk about climbing mountains. Thanks so much, Steve.
Thank you. Thank you.
You've been listening to Health on the Line from the NHS Confederation. Visit nhsconfed.org for more information about us and to register for events and webinars that delve deeper into the issues explored in this podcast.